Cool. So thank you very much for joining us, Christine. So for this interview, we're joined by Christine Provvidenza, who is a Knowledge Translation Lead at Holland Bloorview Kids Rehabilitation Hospital. And Christine's very kindly taken the time to be with us today to answer some of our November questions. So Christine, over to you really. So if you can tell us about yourself and your role, please.
Thanks, Emily. So just to give you some background about myself, I have a Bachelor of Physical and Health and Education, as well as a Master's in Science in Exercise Science from the University of Toronto. And I'm also a certified kinesiologist. I've worked in healthcare for my entire career, and when I think back to all of my roles, I realize that knowledge translation, or KT, has always been an integral component of my work. I just didn't necessarily know it at the time. And I'm really super proud to be in a KT-focused role at this given moment. So as you mentioned, I'm currently the lead of knowledge translation at Holland Bloorview Kids Rehabilitation Hospital, which is a hospital for children with disabilities and complex care needs, and is located in Toronto, Ontario, in Canada. And I'm so proud to be a part of a team called Evidence to Care. And Evidence to Care is the knowledge translation hub at Holland Bloorview. Evidence to Care is an organizational mandate to help create an evidence-friendly culture where we support our staff, clients, and families where appropriate to turn to the research evidence and to feel comfortable doing so. And one way we achieve this is through knowledge translation. Now, Evidence to Care is built of a team of knowledge translation practitioners. So we have a manager, a knowledge translation specialist, as well as a knowledge broker, and then myself as the KT lead.
Brilliant, thank you. That's fascinating, and I'm sure you know, our library and knowledge specialists in the NHS in England and the UK will be really fascinated to hear about your work over in Canada. So how do you describe your knowledge translation work, and how does this fit with the work of your team and the wider organisation?
Right, so our team has, our entire team has a master's degree in health-related field, and we're all trained in knowledge translation. So we've all taken accredited courses to build our knowledge translation competency. And when I think about the activities that underpin knowledge translation, all of our work, myself and the entire team, it all falls into the different buckets of KT activities. So myself, I focus on knowledge product development and stakeholder engagement. So this is where I take research and experiential and contextual knowledge and synthesize it to create a product for a specific knowledge user group to address a gap that exists that meets their needs at the same time. Paired with product development are dissemination and implementation efforts for those products depending on the given knowledge translation goal. Now, our entire team brings different KT competencies to the table. So some of our team members specialize in knowledge gathering and synthesis with an aim towards creating products such as a rapid review or a standard of care. Other team members bring an evaluation lens. But together, we all engage in dissemination, implementation, evaluation, and sustainability activities. It is really nice because we all support each other in our work and bring different KT strengths to the table. You can see that each one of us is both a generalist and a specialist at the same time.
Brilliant, thank you. That's really interesting, and I think you know, I think we can sort of recognise some of that, you know, some of the aspects you mentioned there from our own work, but some of it does sound quite different as well. So that's really interesting. Thank you. So what does good knowledge translation look like in your organisation or within your programme?
Well, I mean, for me, good knowledge translation starts by having conversations to truly understand what the ask is or what the gap is that needs to be addressed. And I think, you know, having open and honest conversations about expectations, timelines, roles, responsibilities, and resources is really critical. Ensuring that an appropriate knowledge translation goal is in place and understood by all members engaged in the work is super important. Also, leveraging KT best practices and using models, theories, and frameworks, really leveraging the science to guide decision-making and inform the work to help with planning is, I think, really critical in terms of good knowledge translation. Also, for me, taking an integrated knowledge translation approach where you bring different stakeholders to the table through various phases of the work to ensure that their perspective is represented is really important, as well as understanding the different layers of impact. So ensuring that evaluation is top of mind and that we engage in purposeful evaluation planning is something that's really critical. And also just thinking from a pediatric rehabilitation lens, from an evidence perspective, pediatric rehab is still very young and brings its own opportunities, but also challenges at the same time with respect to different knowledge translation activities.
Oh, that's brilliant, thank you, and really fascinating, and fascinating to see the contribution that knowledge translation makes, particularly in a new discipline such as that. So yeah, really, really interesting. So what contribution does knowledge translation make to the programs that you work on then?
I think for me, when I work on a given project, I feel like KT brings structure because there are best practices and principles. There's, as I mentioned earlier, the science, so models, theories, and frameworks. All of it to me provides a foundation and a reason for why we do what we do and the steps that we take to get there. We often characterize ourselves as process experts who can bring a clear structure and a systematic lens to tackling knowledge translation needs. And I feel like knowledge translation really has the opportunity to elevate the work to a level that has not yet been imagined.
Brilliant, thank you. Again, really, really interesting, and really fascinating to see that contribution. So. Okay, so thinking about sort of challenges and some of the challenges you face. So what is the greatest knowledge translation challenge that you face within your organisation or those programs you've been talking about?
Right. Well, I think part of the challenge is helping others to understand what knowledge translation is and the value that it brings, that has a place or serves a purpose in their work. And I think, one thing that's commonly part of our conversations is being able to adjust expectations for the work. How much work is really involved, how much time does it take? So being able to balance time with leveraging best KT practice, thinking about resources, all of these things are part of a conversation that we've had when it comes to knowledge translation. I think the other challenge is, being able to navigate different perspectives and ensuring that all perspectives are represented. And so being able to facilitate those conversations with care is really important when it comes to knowledge translation.
Brilliant, thank you. And yeah, I think again, I think we can recognise that the importance of facilitating those conversations and making sure knowledge is translated, I guess, in a meaningful way. I think that's something we come across quite often. That
absolutely,
things have to be meaningful to the patient, to the clinician, to whoever is going to act upon that knowledge. So yeah, really, really interesting. Thank you. So. Thinking now about obviously you've been talking about all of this brilliant work and all of this these amazing things you do, so what do you enjoy most about what you do, and what's been your proudest knowledge translation moment or moments, please?
Well, that's a really big question, so I'll try to pare it down a little bit. But what do I enjoy most about KT? Well, engaging with different stakeholder groups. I love to engage with people, and being able to do a deep dive on a particular subject area and kind of throwing myself into that content so that I can effectively align the subject matter with KT practices is something that I really enjoy. Also, being able to see something come to life. So whether it be a product, a dissemination, or an implementation plan, that's not only a reflection of KT processes, but of everyone's hard work. So the collective input that goes into creating those plans or products is just simply amazing. But the other thing I really enjoy is when the project team that I work with has an aha moment about knowledge translation and they can see the connection of KT to their work. That is truly amazing and something that I love to see as part of working together with individuals. You asked about proud KT moments. So I'm going to have two that I talk about, if that's okay. One proud KT moment is an infographic workshop that our team has created. So we created an education workshop to support families in making infographics to help advocate for needs, services, and care for their child. And this idea emerged from a family leader at Holland Bloorview. And this family leader partnered with Evidence to Care to create and deliver this workshop. So the workshop really does focus on skill building. So how to write key messages, how to use infographic software, how to build an infographic using best practices around color, images, and language. Also that they can create a tool that will help them advocate for their child's needs, services, and care. So we've delivered this workshop probably 3 or 4 times, and we've engaged in evaluation efforts along the way, which has really allowed us to tailor this initiative as we go. And right now we're transitioning it into an online format. And it's something that we're really excited about. And once that's up and running, I can share the link with you so that you can forward that out to your colleagues if you're interested in doing that.
That would be brilliant, yes.
Oh, yes, no problem at all. And another proud moment is working on a living guideline for diagnosing and managing pediatric concussion. So this guideline is funded by the Ontario Neurotrauma Foundation. And the work is led by 2 amazing project leads. So one of our project leads is from the Oak Concussion Lab at the University of Toronto, and another is from the Children's Hospital of Eastern Ontario. And my role with this guideline is that I'm the knowledge translation and mobilization lead. So the guideline itself is for healthcare providers. And, we felt it was important to help healthcare providers be able to share and use the guideline. So as part of a larger planning meeting around the guideline, we were able to host a knowledge translation planning workshop. And during that workshop, myself and other members of Evidence to Care and volunteers, we worked with the expert panel members to co-create a dissemination plan for the guideline, as well as identify key supports that would help foster implementation. So this has led to a variety of KT products being developed, such as a slide deck on how to talk about the guideline. So they can use the slide deck to help them share the guideline with other stakeholder groups, as well as a document on how to best share the guideline, as well as use the guideline in their practice. Now, while the healthcare providers are the primary target audience for this work, it's important that we also have resources for youth with concussion and their families, as well as for those who help support kids with concussion, so teachers and coaches, for example. So currently, I've worked with families, teachers, and coaches to create resources that specifically meet their information needs regarding concussion as it relates to the guideline in a format that they prefer. And right now I'm working with youth to do the exact same thing, to understand, what their concussion information needs are from the guideline and how they would like that information to be shared with them. So those are 2 different types of initiatives that I'm working on that I'm really proud of.
Brilliant. I mean, they both sound amazing, and yeah, you should absolutely be really proud of all of those. And I think, yeah, just goes to show the importance of good knowledge translation and the real contribution you can make, and particularly something like concussion, such an important topic to have, to have the right information, the right evidence, and that to be well presented and well translated. So yes, that does sound like an amazing 2 amazing pieces of work there. So I'm sure our networks will be really fascinated to hear about all of that. And thank you very much for taking the time to be interviewed today, and for sharing some of your knowledge translation and knowledge mobilization work with us. And thank you very much.
Well, thank you, Emily, and thank you to Health Education England and the NHS for inviting me to participate in November. It's been a great pleasure speaking to you. So thank you so much.
Thank you.